Thank you, Dr. Ryan. I now have Thomas from Bloomberg. Thomas, can you hear me?
Hello, yes, this is Thomas Mueller from Bloomberg News. I was just wondering, as the rate of infection increases so dramatically, is there a point that it's no longer controllable?
Just globally, or
I'll start with that, and maybe Dr. Tedros, maybe Mike would like to answer. So I think, you're saying that the rates are increasing. I think the more we test, the more we're going to find. And that's in one aspect, it's an overwhelming thing to see these case numbers increase. And in some cases, in many countries, the case numbers are going to increase care. They don't progress to severe disease, if that's possible. To find all of their contacts, to follow them for 14 days. If you quarantine your contacts, so remove them from the family home or remove them from the community so that they don't have the possibility of transmitting to other people. To having strong leadership, strong political leadership, repurposing your government and having this whole of government approach. To engaging your population, communicating with your population regularly so that they can go through this with you as you adapt your measures, you implement certain control measures, you may lift other control measures. Empowering your population so that they know what they have to do in this fight against COVID-19. We have seen in a number of countries, and the Director General had a very important meeting today with many ministers who shared what works. And what works is this. What works is case finding, is contact tracing, is mobilizing your population and communicating with your population. It's making sure that you have arrangements in place so that people who need to be cared for can be, so that healthcare workers are protected, so that PPE is used appropriately and that they're saved for frontline workers and utilized by those that need it most. So your answer to can this be controlled is yes, but it takes a lot of aggressive measures, this comprehensive approach that we have been outlining. And countries will see improvement but as they move through the different transmission scenarios. And so we need to apply what works to show that there can be suppression that can happen with this virus.
And if I could add, it's really important at this moment that we don't create perverse disincentives to detect cases. We should commend countries that are testing, and we should not punish countries for getting larger numbers. We should recognize when countries recognize reality. We should reward countries and governments for looking. If we create a situation where we overreact to the daily number, then there's a disincentive to actually test. Countries who test and find cases and do lots of testing and know what the virus is should be commended. Secondly, we need to look at rates of things. We compare raw numbers and it's very, very unhelpful at times. We need to look at what is the number of cases as a proportion of the whole population. What is the number of tests as a proportion of the whole population? What's the positivity rate of tests? How many tests have been done, and of them, how many are positive? They give you a much better idea not only of the impact of the disease, but they give you an idea of the effort being made by the public health authority. But it is important that when we look at these numbers rising, part of that rise in numbers is increased detection due to better testing. And we need to be careful that we don't punish people for testing. Having a larger number means I know where the virus is better.